Perfect. Una kusha una kabo. Una welcome to the Well Body Better Gently program. When a Salomon, they don't learn Boku book. Not to me, Salomon don't learn Boku book. The one who they present, they don't learn Boku book. Now the bring account now. Today, now the 70th session with the G. Let us just bring down the up a bit. There we go. So today, now the 70th session with the G, as you see. We don't be around for long, by right now, to be honest, what is here that people in the follow, I know I say follow market, but then they copy because it's always good for copy something good. And when they look like say now, we don't talk grandpa and granny, we don't say we don't born picking them. But yesterday, at the 70th session, we deal with complexities of managing chronic pain. Pain, then different, then they in different types. I remember Dr. Kamara, we don't do part 1 of part 2. And today is Sunday, the 22nd of October, and Dr. M.S.I. Kamara now they present to us today. If I say I explain what this man don't do or what he do, I notice I will do injustice. So I go left and learn talk for himself. And me own name, me not Timu John Fuller. Me not a medical person, me not like kuna no more. Well, most of them because also some of them are doctor. But me not a medical doctor, me a business IT consultant, I did into IT security and anything to do with IT stuff, projects and stuff like that. Okay, and like I say, in the panel we get Boku Bukmandem, we na the Well Body Better Gently team. And the team, we get people then from nutritionists to pharmacists to general practitioners to emergency medicine consultants, public health, mental health nurses, general nurses, pediatrics. We get all. The family them they are big. The presentation will give, even though we might give scenarios that we similar maybe to your situation, they are family are big. Not to you in particular, we refer to. Okay. So just in case maybe you don't talk to one of the doctors, the example that we give are generalized advice, generalized examples. We could say we don't want to help people them more, but because we don't get to a medical background, we're not going to do a personalized advice. We only go give general advice. We go ask any personalized advice, seek medical advice from you physician, from your medical practitioner. Because I then get your medical record, I then get all your vitals for the Okay, we will continue. As I say, now the team, we not only get paid, it will go no more because we left the country and we want to try for help mankind. Now we could do them. So do you learn office anybody they get paid now? Yeah? No, out of love for the country and out of love for mankind, I make could do them. However, we try for get through to mainstream media and salon. If anybody gets any way, we not go cost we money because if imagine people are they give up their time. If now work can be the work, imagine how much they pay them. We know how much doctors and they get paid. Me maybe na the man na the team. I know how much they get paid. So compared to that, they are when I book command them. If they give this time for let them get paid, imagine how much they'll get paid. So you not go fear again after they don't give up their time for let them pay again for let them on radio or TV. But if anybody get way, for every day on radio and TV, we they give the program for free. Okay. Anybody can please be in touch and once the end of the share and contact, feel free for getting in touch and we're happy to give you. Okay, like they say, we recordings go there on YouTube and Facebook, and we also get a WhatsApp group. The WhatsApp group, not the general WhatsApp group, we all man they talk, boku stuff, we send politics and stuff. No, we restrict them to admins only, and we only put stuff the way medical stuff, the way maybe something way they happen or until they won't need for know or think about the program, and we can try information so we not send stuff very late in the night because we know say people then when they sleep. Okay. We will share that information as well if you want to join WhatsApp. Okay. Now, like they say, if you want to ask question, you look at this post. This most likely now this book people in the see we they listen to we so now. So if you look now, I get 3 buttons there now. If you click on that button there, you will see this bit. When you see this page, if you click on this, you press on this bit now, you be able to send we message like how you text them on WhatsApp or like how you do on Facebook. So if some of we know to all man, bold like me, or get fine voice like me, let me say bluff small. We go ask question. Okay, so if you shame, ask question maybe or who's idea in noisy, you can use this format, send you a text message. Okay. But also if you want to ask question verbally, please use this for raise your hand up. I will come to you. However, if you're not able to do all this, no worry, just raise your hand up physically. If I see you, I will come to you. Yeah, if I don't see you quick, I don't come to you quick, not mean I ignore you. But once I see you, I will acknowledge you. I don't see you, and then I will come to you for you ask your questions. Okay. Now I don't talk boku, and I don't listen to me coast voice. That I can pass on now to the professional, the one I can also can listen to. But like I said before, if I get any questions, suggestions, or feedback, please send me an email or get through to me on WhatsApp. Okay. When I feel free, for me, I go say anything when I feel for say. If I feel say we not do I'm fine, when I tell we say we not do I'm fine, we will let. But however, give we small bunya, tell we say when I try for make and so. We say if we go try. Or if you feel say you get the technical skills, we better pass me. If you say you able help with a lot of develop the program, let it be more, more watchable by people. Get in touch. Me support that. Let people support the program. Tell me say change it. I will change it. Okay. Well, thank you guys very much for listening to me, Dr. Doc and Uncle Doc. Over to you.
Right. Thank you. When I can join me today. I don't know if when I see right, okay. So when I see her now, that's why they don't tell me. Thank you. Well, anyway, this topic we don't do part 1, and people then be enjoying so much. Now they say, we could do part 2. So today, now we say, we could just try and do what you go for do. But I thank you so much for when I take on time for come and can join me for listening to me, and hopefully, we're able to raise the awareness. We were able for maybe educate ourselves. We will share experiences with one another regarding this problem. This problem is a big problem. If I tell you true, it affects, imagine this, 800 million people in the world. So we within we own country them, we they suffer more than we which man compete them. But when I go find out, and I make it important. It's so important that this big organization we call World Health Organization, when at the end of we boss them all over, they actually decide say September. Now the month of that we just done. September we've just done. Now the month of that we dedicate to this sick, this problem. So what I do, as I say, I can always look for people the only way they listen to it, make them see and make them actually then get warmed up. They go play a match, they warm up, otherwise you get injured. So I bring this slide for let people then look at them and see. If we get a chance, anybody we see word where he see say now in this talk there about which we try for do, he can actually say, and the first word where you see talk and then we can actually say 1 or 2 words about that. Then we can go into the the presentation itself proper. So if that's okay, I don't know if TM you go for unmute people and for let them just talk. Would I want first word we see them or just say something and then we will talk about that slightly.
Yeah, I don't enable them for unmute.
Right. So yeah, fumble them. When I look this slide at the left hand, see waiting any word where you see. If you want to talk, just call the word number. And then we will say 1 or 2 words about that, if that's okay.
Alleviation.
Who said that?
Me.
Oh my God. Well, I don't need to go further. Now the word that I really look for. Wow. Well done. Thank you. That is a big well done to you, because now that 90s talk there about. You will see all the other word them, but alleviation, because waiting do this sick, now sick when they well completely. So which will they try for do? Now how you go manage them when you get them. Not all man go get them more. Anybody will get pain, no means say you go get chronic pain. But the one they will get chronic pain, now you will not get cure. So which you could do now for alleviate them. Now I think it's not been the word that I'm looking for. Thank you very much, but well done. As I say, September now the month that we then declare for raise awareness for back for pain, not necessarily back pain, just for pain, and for understand what you for do about them. So I can always look for begin by defining for this, actually tell people what you mean where you see this person get chronic pain. Well, chronic pain, now pain will begin, all of a sudden, it just begin. That's not the acute pain we don't talk about. But this pain, it don't continue now, it don't last, say it past 12 weeks. By the time it is 12 weeks, 3 months, now we don't become chronic pain. And for people who think say the pain at the back no more, they were not so. The truth of the matter is that this pain can happen at any part of the body. When I go see just now, I go tell you now. The pain can do it all the time, or it can come and go, or they can describe them in different way. When I go find out as we go on. But punch up the bargain, pan this chronic pain, and get another subsection we then call high impact chronic pain. This one now is so bad that it they actually interfere with your daily activities. you work way to do. Sometimes if now for clean the house, for cook, even sometimes they for go toilet, for wait pizza, for wash, for get a shower and things like that, for iron, for brook, all that things then they can get affected. But mainly like the high impact chronic pain I can do. As I say, it can cause a lot of problems to the extent some people can get depressed, some people can get anxious, and it can cause problems for sleep. Well, as I say, when I go see exactly how it go on. But the key thing here is how we for try for break that cycle day. Because this thing lead to another. 3 months, it begin lead to one thing. And now we need for stop that thing day. We need for break that chain, As you see, look at them all. So chronic pain can affect the nerves. It can then at the neck, it can then at the arm, it can then at the foot. And so people that will get diabetes, but tranga one then go tell you say then get that in there. Sometimes feeling that the foot, that the leg them can be not to the same, like how the other person they feel out. Now it makes something they can wound, they don't even know the wound, and then the only time they go find out now when the thing don't become infected. When infection then at the foot now then begin feel the pain, then they can know. So diabetic neuropathy, people who get diabetes can get that. People who will get that pain at the back, lower back, usai, the nerve where they supply the waist, can down to the leg, them can down to the foot, then they self it can cause that, And then pain can then at the leg them, it can get pain because of the fact we all who they grow older, the spinal cord, inside the bone them at the back, then get cushion, as we not talk the first step. But that cushion they can dry up, that cushion they can leak, and when it leak, now the bone they rub on the bone. So that they can cause pain and it can cause inflammation. That can cause then the cancer cell of the spine can cause that. Arthritis, where we know that it can cause that as well. So it can happen any side. Look this. How common is it? Well, in America, 1 in every 5 people, 1 in every 5 actually get chronic pain. In we part then of the world, I know you will get the statistics exactly for this year or, for Salon. But in we own developing country, then we get up to 25%. We mean 1 in every 4. So Salon population, I think we get 46% now 15-year-olds, 1 to 15, than that. So then possibly not go get that. But as then they grow older, then go get that, developed. And you go see, say, even in the young one, them, the amount or the percentage don't they rise in the past 4 years, especially since the pandemic, since COVID began. When I go see that as we go on. Out of them people, and they 8 in 10 people, them, then get chronic pain where they affect them and it can cause them severe depression. 1 in any 4, when at 25%, can get problem for sleep because this pain can so bad that it interfere with the sleep. And if it interfere with the sleep, well, we know what it will lead to. And as I said just now, 10% of the world's population. Now, before the pandemic, we've been noticing that 8 billion. Now, after the pandemic or with the pandemic, they don't, so we know say way, way more than that. Because during the pandemic, the born being they agile, people in the born. So definitely the population don't go up over 8. But imagine 10%, which means 800 million people they suffer with that. Look at this slide. 2017, or that about 5-6 years ago, you can see say the woman them, then they suffer more than the man them with this chronic pain. The reason for that, now the way we God build them and the size of the pelvis and the fact say now then they born and then they carry picking and then get this teen way now menopause after then left for able for born picking them, So definitely then they suffer more. We can talk on that later on as it were. But if you see that the right hand side, the right top, you will see say not to just the back. The back, in fact, 9 and number 2. In terms of the areas them where this pain they are more, this chronic pain. You could see and say 42 now just the back. But of course, underneath that, you see the neck, the shoulder, and the belly, followed by the head and the chest. The chest don't in bad, even though not the least, but in bad because chest pain with the worry say the person possibly can get a heart attack and then the native they kill quick. So therefore, we can pay more attention to that and we can act on them quicker. But looking at the bottom right, you go see say some man they feel say because they're underweight, they no go get pain. Well, look at that. 29% of people that were underweight, then definitely can get that chronic pain. But as you go into the weight, the pound and they add up, the kilos and they add up. Well, by the time you get to the very, very big, very, very, overweight, about 50% chance they say you can get the chronic pain. And of course, if you look at the bottom left, you can see say as you grow older, you're definitely more likely for develop than when you're younger. Because when you're younger, you compensate better, you move better. The cartilage, they're all they're supple, they're good, they're robust, they're elastic. Whereas as you grow older, then dry, and then of course then can cause problems. Look at this. As we talk no more, the most common part where it affect, or the most common condition where you go get chronic pain power, na arthritis, where they affect the joint them, and it can be any joint, but mainly na the big joint them, like down there the knee, the elbow, the shoulder, and of course the neck and the lower limbs. Then you get the back, and then followed by the joint pain and the nerve pain, where we get like migraine and different things that we can cause. But outside people, we don't talk about that only. Outside people, they get this pain, we don't talk about that. So not to just the back and the neck. So Monday you can get the bolocos, where itself can cause pain. So Monday now outside them, we don't cut, we don't do operation for now. The nerve can become inflamed and that it can cause pain. So man, the fact say he get cancer, now in the gear and the pain, and that can happen something at the back, something at the bone, then different one, And of course you get the nervous system, outside the nerve, then the way they supply the body sensation, outside in the field, that itself can give you pain. So then they're different type, and it is not to just no more at the back. So man can face when say chronic pain and just back pain. No, far from that. It can affect any part in the body. Again, we just talk who that likely forget this chronic pain, as I say no more. As the age they grow, then they can say when you get to that 3-10 biblically, well, like that, 70, and if you get disability, you're more likely forget them. So at 0 to 5, they get them like that. But of course, you begin now for growth. By the time you reach to 70, 3-10, well, like that. And if unfortunately you get a disability, that's even more so than the one they will not get them. But look at this situation outside, then they actually break them down to we young people them. The bottom left, you could see say we black man, 44%, almost 45%. We can round them up to 50%. Whereas the one day now we counterpart them, we white man then at 34%. So a good 10% difference between we and we white counterparts. Then of course where you see say outside the mix, mixed race, then the way white and black mix. You can see say themselves then they higher up. And then of course the other one then now all the different ethnicity, then say now at 26, then they lower than we. But for some reason we get more. And you can see say them, they're more likely to get this chronic pain when a high impact one. Remember, I've been talking about that high impact chronic pain. Human, they're more likely to get them compared to man them. And look at the top left. You will see say the people that they live in a deprived area. People that we poor, sorry for say, then get more likelihood for develop that at about 30% compared to people that we in the rich areas there. And of course, as I've been saying no more, the young one themselves don't begin notice a rise in the way this thing they among them. So up to 2017, it don't rise from 21 to 32. And I tell you, by now when they talk 2023, definitely it don't go up. I don't get the details of that. Look at this. How will they affect people in life? Well, 50% of the people that get chronic pain, they're not able to do their daily job, their daily work, what they can do. In the way you can take for granted, where you go do it. Like mama, the old picking, this one, they walk, they lift, this one, they go up, they claim and all that, they need for do. So half of them, they will get chronic pain, they know you for do what they want for do. And if you look at the top right, you go see, say, the pain they cost the economy in any government, a lot of money. So 50% of the sick note that we will give, we as doctor them, they come from chronic pain plus mental health problems. So it just tells you, if you imagine, that billions of pounds now they cost, for this thing where na team wheels until they take light. And then the one day we they suffer with them again, 50%, and they think say then they lose control. They know for control them pain because the pain they get out of hands. What if we do now for try for control this pain is waiting we're going to talk about as we go on. Now, 14% of the people that we get chronic pain then can get this disability severely. It can bug them really bad way to the extent they're not able to do anything for themselves. And 66% they get difficult for sleep. So this is absolutely vital. I like this slide because we all guilty to some extent, you know, me myself included. Look the left top, you can see the poor posture. From where all man begin use tablet, begin use mobile phone, every way they go na place for it, you get that in there, you know, all man they go to. You see how the posture there? And if you look the one within at the middle and at the top, you will see say most of them secretary, the way they walk. My colleague there, he go verify that for me. They actually can design chair them for them so that they go sit down properly, and then the desk then go the proper height, proper fingers beside them for this so that they don't go get that problem. But look at that. Next to them, you see, we will like for wear high heel shoes. Woman them, we auntie sister picking them. Well, look at more wrong footwear can actually, you know, make you more at risk for get this chronic pain. If you be a woman, as I say already, 31 to 38%, and if you did at the family, definitely you get more risk, you're more likely for develop them than not. As you go older, you know, as the age they add up, now so you get more likely for get that problem. People away they in the chairs and all that, then they overuse, they limp them. So therefore, the athletes, then they with the run, then they with the sportsman, then they all themselves can get that in there. If you overweight, and of course, if you get trauma, you can actually more prone for get that in the chronic pain. So again, this one just they tell me how this chronic pain day, you know, what is there about the fact them and the research still they go on, and that 1.9 billion people them, nine them fan, you know, forget, like for example, that tension headache, we very common of this symptom. The tension headache we get for do with blood pressure and all that, it can become chronic pain. And then you now get a difficulty for distinguish for proof say this one na pain way na the aid they cause them and not to the mind they cause them. It's a very difficult one, and so obviously it's nice for there we're able to do something about it. But the research they go on and people still they carry on for do the work for time and see how go get them. Obviously, if I talk about pain, if I learn to see waiting pain they about, where you get them acutely and when it become chronic, as we say, from acute to chronic, now 12 weeks they between them, 3 months. But the acute pain is different from the chronic pain because waiting to the acute pain, who we not talked about before, they begin like that suddenly. So until you want to go inside the car, you try for go sit down in the car, you feel, like that, you freeze, you just stiff, like that. So until then you butu for pick the picking, so until you don't turn 1 year old, you don't turn 10.5 kilo, you want to with one hand, you go, you bend. The next thing you realize, like that, you freeze. So that's it. Whereas with the chronic pain, that thing way can they on and off, can begin, and then they can and of course it change in intensity. The way they, some man go describe them as a burning, some man go describe them as a throbbing, some man go describe them as pinch, you know, some man go describe them as the sensation less, some man go describe them as numbness, different way, you know, when they describe them. So you need for actually know the difference between them. And of course the acute pain, something specific, like can cause them. As I say, injury, something that you can get sick, we can trigger them. And whereas with the chronic pain, it not depend on any kind of specific illness or sick or injury. It can happen, but sometimes it can come out from a sick way, but not begin acutely. But as long as it lasts for 12 weeks, that pain day, it now don't become chronic. And it can require a lot of aspects of trying for find a package where go work for the person. Whereas with the acute pain, you can find out who's had the problem there and then treat them. For example, if the person wound himself, you go dress him and sometimes you go stitch him. If he broke his bone, you go put bandage or a cast on him, that plaster of Paris panel. There are different in them. If Natiwe needs surgery because you get pain, you can do them straight away. So now the difference that between the acute and the chronic pain. But the chronic pain, well, for be honest with you, this 90 worry me, this persistent pain cycle. Then they nine the problem. So now this cycle nine for try for break. Because waiting do when the pain don't turn 12 weeks, it don't begin. You now they get what we call deconditioning. The muscle them, the ligaments, the tendon them, the bone them. The more you turn them over, the more you move them, the more then they bulky, the more then they active. The moment you left for them, up to 5 weeks where you didn't bed because you're afraid for grab, you think say, this thing I go for them, or maybe in the grab I go jog, this and that. Now no able. You now they become deconditioned, and so you begin for put on weight. And then the next thing you realize the fear they on you, that afraid they on you now, you know for go do what you want for do again. Then of course you begin think about that. As you think about that, until you go lay down and then to side, you know for sleep. You eye open like that, you still lay in pain. Nobody they see what you do because the place dark. And then waiting they happen, this sleeplessness, this sleep you do the sleep now, they lead to fatigue, they lead to tiredness, and then of course you begin worry about anxiety. You begin worry about waiting for do now, me work, me picking them, me family, how I will look after them. I lost me work, and if I lost me work, what go happen? If I don't pay me bill, then what go happen? Bailiff go come, then go foreclosure, then go throw me and all that. Then of course you begin eat wrongly, incorrectly, and then you begin add on weight. Well, that's the last you want, because when you add on weight now, you become inactivated and deconditioned. Well, you know, if you do what you want to do. And so therefore you begin to think negatively. That lead to depression, that lead to mood swings. And then, of course, it can lead to relationship problems, where certain it can lead to divorce and even sacking from your job. So that, now the cycle where you want for pray God say, day in. If you did it, ways and means for try for break them down. Again, this one just to tell you about that. So the pain day, the anxiety of the pain, the signal, the tissue damage and the harm. And that day now they make the brain begin focus on this thing. And so it changes everything. The system, they change according to the pain. So the longer the more they say, then they pan this sweat. The brain, they say one thing, the body, they say another thing. The brain, they say, I don't used to this thing because now 12 weeks I don't get it. The body, they say, this is not fresh pain. So then get that first day, up and down, here and there. And now you get for try, forget that neutral thing, forget for day in the middle, and try forget you will go benefit you, where you go get away from that pain, the way you go break the pain cycle. As I say, now so then people here, they can describe the pain if you ask them. If you come to me, I ask you how, which day and say I get pain, well, how this pain? You will say sometimes actually they ask me, sometimes they say they bet. Sometimes they like say way something they sting me. Sometimes they can make I feel stiff. But me, they talk about stiffness because when you wake in the morning, you can feel stiff. And sometimes they can feel say eating like electricity, where they pump at them, and then they can feel like say it shoot from one side to the other. Then sometimes someone can say you feel like say somebody they squeeze them. But look at this. This is so nice. It just show you how the world there. If you look at them, the iceberg, waiting there on top, and now waiting there, now waiting, then the way they outside, they look at you. And the way they look the lens from outside, then they see persistent pain. Say, this person is deep and pain. Now that no more than they see. You will get the pain. Waiting people in there, they see, now then see with the bottom, at the below. You will see, as I say no more, the shooting pain, the pressure, the numbness. And then it'll make you irritable because for sleep, you get tired, you get anxious, you get depressed. All that thing then they see. But you now way they pan the problem, they see, I know I'm definitely. Now some man can say when a baby, when a picking them, they never get them. Well, I can tell when I say picking them, they get them, as well as the old one them, as well as the adults. Anybody can get them, So picking them, as you can see, up to 35% of picking them can get them. But one thing me as doctor can tell people them is that picking with pain are two things when they go together. It's very important for people to know. If picking they complain of pain, especially in the back or the joint or somewhere, I beg una please when I try and bring and come to the hospital, let them look at them because something they do in a different thing than we can find. But now no say definitely picking themselves can get that thing. They own in bad because what you do when they get chronic pain, they make them irritable, then get miserable, then get angry. And that they not sleep. When they not sleep, then they tire all the time, and then they make them fall behind and then school work. So we will get them picking the way, can complain, do you make you pay attention to anything they do? Because they begin fall behind and work, then they give them stress because they want to do well. They want to play with them, party them. They never for play with them, party because this pain they monitor them. Now, because it affect the relationship they were in the build, they become lonely, and that leads to sadness. And again, it goes to that cycle because all them picking them way well, you will see them they run around, them full of beams, charge there, left, right, and center. We see this one sit down, you know, for move, they complain, say, pain day, please try and see. As long as you know for them, because if you for them or injure yourself or something, somebody push them or something, you know, say that this nine cause up, which is different from where you don't get this pain, you don't the amalgam, and then we just say, okay, low give Calpol, low give Profen and all that. But you need it better. And then you find out now, say, you need the walk, you need the waka as it's supposed for. Please pay attention to that and bring and come to we or the GP as soon as possible. So the other side of the spectrum, when the old people, then on the danger upon them is that then they tend the way they bond them, the generation we then get, then they hide their emotion. They don't become a burden to the people, the family, the carers, them, the man they with them. You know, they don't want to become a burden. So therefore, then they mask them, then they trivialize, and they hide them. And then pain perception, because the nerve they're not as active as them in the is quite low. So to tell by the time they come to you in the hospital, they, you know, it don't go too far. So then get more chance for develop this than we, the younger one, then we go feel them quicker. Then pain threshold really high, you know, as opposed to the young one then. You know, so the sensitivity to the pain is mild, it's low. And of course, I know say this apply to people who can get cancer, people who can get problem like the belly. Like sometimes you get ulcer with boss. They could begin hide this pain. So like by the time it come to you, you go see and they sit down, you know, move at all. Then when you press the belly will rock hard. By the time you go do X-ray, you go do blood test, you find say, oh my God, this person don't develop sepsis, don't go into shock. And by the time they say for go operate, you don't too late for operate because what you know, you likely say if you go operate and I go down in the table. So all that thing and then that thing that we need for think about. If we see with old people, you see then they quiet one, normally they can talk to you or something, they get agitated, they get confused. Member say something now ordinary water infection, I ain't gonna make it more confused, you know. But they're important for making member say, this not to be papa, this not mama, not to so he can day, you know, he can laugh, but this one you don't change now. But if you say they're in pain, they say they're in pain, take that serious and try and do something about it. So waiting they cause them, and waiting the symptoms the way we get for chronic pain. As we say, chronic pain, nothing no we go say pinpoint your finger, point say na this na in cause them because waiting do it can happen at any time. But that no mean say na everybody will get pain, na in go actually develop this. Sick then like arthritis, like cancer, can cause pain when na ongoing pain. So then they then can become chronic. But that no means that no more they cause them. It can be something else we combine with that. So if you get, you know, an injury, you fall down, you sprain, you strain your ankle or your arm or your elbow, your shoulder, or you broke arm, then go look at them, do an X-ray and find out, say, nah, this, nah, yeah, bug you. And then, of course, you go get pain with them, swelling, bruising, some deformity. But then if the pain remain after the fracture or the sprain don't heal, don't well, then now you know, say you get chronic pain. And that now a bigger problem. So intended the pain not to because of the injury or any kind of illness. It can be said that because of psychogenic pain or psychosomatic pain, what they call them psychological factors like stress. Believe it or not, stress, too much stress can actually increase pain. Anxiety, that anger, that, you know, where you at the anger and all that, then they can cause, and depression, of course, and they can increase pain. And that can cause this chronic pain. So, as I said, two sick then can exist one with the other, but that not means now one or the other nine cause them. It can just do it, and then of course the two way they cause the pain, you find for let we know what now. This now for the medic the way they amongst we way something then go there, then go see them for themselves. That the brain gets a lot for do with how we they perceive, how they know, say this pain they, you know. As it is, you get 4 part them and the brain when and then they actually process this pain when it come. But the more important now for look at the 1 and 4. 1 the amygdala, now they send the signal for activate, you know, the nervous system, and then he create this thing we then call adrenaline, which until we all don't hear about, and they help you for fight, you know, fight and flight. You see snake here, just not run you the run, you know, all the things that they nine they do. But then number 4, you know, that not the one way nine they help for decrease the pain. So 1 they work with the other. 1 and 4 they work with the other, and of course, one way not to medics then so them, at least not the only way that I go explain, but the medics then go see which I try to talk about. So when somebody come to a doctor and tell and say he get chronic pain, before he come to that diagnosis there, he get for do something, he get for ask him, he get for talk to them, he get for discuss with them. And in that discussion, he go ask you, which him bring you a kind today. The person go say, I get pain. Okay, what's kind of pain? How this pain day? What's I day? What's I been begin and how it been begin? You know, if either it begin now, suddenly, or it don't deal with you for some time. And if you don't deal with you some time, which you don't do about time. You don't take any painkillers or you don't try to do anything about them or, you know, that kind of thing. And then he will tell you how bad the pain is, between 0 for no pain, 10 for the worst pain we don't ever get. You will then give him a score. Then you go know now the seriousness of them. But importantly, he will ask you how this they affect your life, this pain. It stop you from doing your work way they do. If you say yes, then obviously it becomes a bit more serious. And how long you don't get time? If you don't get time for 12 weeks, then it becomes even more serious. Yeah, and of course, he could tell you how you get them. That's where they come and go. Now, something where they bring and come. Any position we go make them worse. make them better. Anything you go do, like say stretch or bend or twist or whatever, but you go get that. And then when you don't get the full picture of how this pain don't characterize them, then go on for say make a check and see waiting at facing and cause this thing. So it will examine you, and when he examine you, it will get an understanding or a feeling as to waiting at the cause of the pain, where possibly you go say a working diagnosis. So now this na me hunch, now this na if say they happen. Then he go ask you for do some test them. Some of them now blood test them, and of course we go do the urine test for see whether blood did they or whether protein did they, because some sick then they now from the urine now you go get them. And then, of course, so Monday you can get this headache, this bad headache. It really the hamburger to the point where, like say, you know, you want for just make them just cut the head come out. So they can go do the scan. You know, when they do the scan, then they go see whether the scan they show anything. If now you bleed, it will tell you. If now the pressure within the brain 9 days up, it will tell you. And if you know the pressure not high, then they can do what they call lumbar puncture. Where now like them when the way they born, they can get a epidural when they give them for numb the leg them and the waist. Take the human bond, then they recover back. Well, then can do that for see within the days, and then go see bloods and then go see tissues. Then we get for do with cancer or any other kind of thing. Then can do reflex balance test them, and then they can do the nerve test them. That now, like where if you look at the nerve they come out something from the brain, hand down to the hand. So in different part then at the arm or at the leg, they can get blockage there. So, but when you look at them, you can't know side this block there. So therefore, then they conduct this test for show you who side the block the way you go for treatment and see how they go from there. X-rays there for do that, CT scans and they MRI scans for there. And of course, if they don't forget anything, then they can go on to this electromyography where the electrical activity of the muscle where nine concerned, where nine they actually affect the place where they pain. So as I say, then they try for the doctor. Then when you come to them after they don't take the history and don't examine you, then go try for find out waiting at this thing for identify the cause. And then of course, once you don't identify them, you could then treat them. But sometimes then you know able for find the cause. So what you go for do, which then called symptomatic treatment. You know, you just did do try for alleviate the pain at least until you're able to find what you for find. That so it depends on the type of pain where you get. Waiting at the cause with things in the pain and how you body there, you well body there generally before this pain begin. But then sometimes day it can therefore accommodate all types of treatment, not to just a tablet, but they can get leaf, they can get other things that they can do as we go see, we go forward. Look at this slide, people. As I can see, then nine can cause me problem because once you get hooked on them, and then most of them are addictive. If you look at the top right hand, you will see antidepressant. Because when we talk about depression, the pain can lead to depression or the anxiety can lead to that. So then they say get your side effect. You look at the top left, you see opioid, then tramadol, cocodamol, then good. Yeah, then can actually ease the pain, but they're addictive. And so therefore you get to think about them, whether you go manage without them or whether you go for continue for deal with them, but then you get for win yourself off them. Then you get look at the one at the bottom left, top big, I say main heavy duty painkiller. Then they use them for people who get seizures, people who get fit. But look at them, pregabalin, gabapentin, then they're heavy duty. People who they take nine that it's difficult because once you don't get hooked on them, for let you unhook yourself from them, it's difficult. So you get to think about which work best for you. And of course, we get down the way we put outside the pain day. Then gets the deep heat, then get that babu bone, then gets the, remember, will be small, Bengus, balsam, then get down there, and waiting at the other one, then get one Nigeria one, tiger or something, then can use that in there. And most of them get the cayenne pepper, caspicium, we know in the use, we can help for heat the place up outside the pain day and open the blood vessel, and then the nutrition go with the blood towards outside the pain day for try for help for ease the pain. So as you say, look at them, you will see all the different one them. This person now, the people in some Monday then get problem for sleep. So therefore, you go say make again something for sleep. That day itself getting your side effect. Then of course you get the one day they can inject to the area outside the pain day in the back and go into the epidural space, and then they inject for numb the place. Something at the joint, at the knee, at the shoulder, at the elbow, you can there. But look at the bottom yonder, bottom, you see medical marijuana. So Jamba, medically controlled itself, can actually be useful in controlling pain, in managing chronic pain. But now not taken from me say na panacea na tiwe agi leeway. Some man say doctor be not talking na for go take jambao. No, it's now well controlled and medically indicated marijuana. Then go down, do all kind of things when no work. But obviously, I know say they work for some people because I know I get a colleague in California where in Peking get that and that in the use with the EPA. But look at the right hand, you go see even artificial intelligence. What they talk about this behavior. Look at instead then they use them for pain. Tele-rehabilitation, then use that. Then you do hypnotherapy, we then go hypnotize you for help you with the pain. Then get cognitive behavioral therapy, exercise, water, for swim, hydrotherapy, all that thing then they then get for epidemic, for let them try for control this pain so that will become chronic. Because once it becomes chronic, it becomes a problem. Again, this one just to tell you, this transcutaneous electrical nerve stimulation, what they call TENS machine, we say get one. Actually, they deliver some small shocks then through the skin, through your body, for go into the place where the area they for relieve the pain. As I've been talk already, the pain management team, some people already know about that, then get their nerve block here, what they can do, then they inject this steroid or the numbing agent into the area for block, the passage of the pain or the transmission of the pain. And then they get the injection the world don't talk about already. Remember, or anything we do, side effect, they risk then they. So if you take paracetamol 2 months, you take more than 8 tablets a day, you can take them accidentally because you say, I don't get nothing else for take. So they make I can take 2 every 2 hours. Well, by the time the 24 hours they done, you could don't take 3 times we for take for 1 day. That day, remember, can cause problems with the liver. It can cause acute liver failure, damage the liver. So it can happen accidentally, and some man can do it deliberately. Again, because of the fact that they ate not right, because they get depressed because of the pain. Of course, the opioids, the opiates, then can cause addiction, and sometimes some man can accidentally overdose themselves. Mood changes can happen, confusion, and of course, the opioid itself can cause problems with nausea, vomiting, and at the same time, it can reduce the ability for breathe on your own. Now that can cause problem where the people for breathe by themselves, they can go into respiratory arrest, where if you don't give them the reversal, the injection way for reverse that power of the opiate, it can actually cause the heart for stop and then the person can die, even if find them in time. The only way to do the injection, then have to be very skilled because it's not easy thing for just mistake damage the spinal cord because of that. And it can cause infection as well because it go through the skin. So all of that, Natiri, you think about, sit down and discuss with your primary physician or with your care provider, health provider, the one they will deal with you, the nurse them, the doctor them, when I sit down, when I format a package where they work for you, and I'm called bespoke, not to one way they say all size fit all. So, but how you go for do something for help yourself? You can forget lifestyle changes way for make for yourself, for minimize the pain. Then they include for bring down the stress level. Stress, don't get me wrong, it's important for everybody for going in life, but you don't need too much of them. As M.S.I said, you don't want no stress, So you need for know when the stress level they get out of hand, so therefore you need for control them and bring and calm down. How you will do that, then get different things, then get meditation, then get mindfulness. Sometimes the breathing exercises can help you for do that. And of course, just get yourself away and do something where go at least, recharge your batteries, where go work better for you and come back. But anything will work for you, it better let you stick to that. Exercise, well, I can't emphasize more, than which I don't say already, it's important. No matter how you do them, even if not just a few steps you make, whether not host now, whether not outside, go around the block, go buy bread to cut or whatever, all that thing then they help. Because the more you move, the better it is for you. Because the muscle then they get conditioned, the ligaments, the tendon, then they get better. Otherwise, if you don't obey, they say enough for grab. Well, all you do now for the condition itself. Because by the time they get to 5 weeks, you're in trouble. For waka, no problem. Now make you see some tendon the old one them when they go in a bed, then go there, they bio, they unbox this and that. The next thing you realize, they send them for waka again. Many a time, then they bring patient then to me when they say, before this sick, let me do waka. Now, after this sick don't come, they don't come to hospital, don't they have 5 weeks, 6 weeks, they can't work again. They get for learn for work afresh. Now, that's not the difficulty now. So important for make you know. The diet, then don't say, the research don't prove, say, if they eat too much of refined carbohydrate and a diet depend on red meat, we will dip and then creature and the obiata and the, fufu and okra and all that. We got to be careful. If you eat them more than twice, in fact, 2 days ago, 9 them bring this paper out with and say too much of red meat can actually increase the risk of diabetes, type 2 diabetes. So it just goes to show, say, that this the thing there. So eat varied diet, a variety of diets where the food that they can eat with, they still get the same value, nutrition, the sumptuous, and of course they're not very taxing on the belly, the gut, and of course the body itself. Plus, importantly, sleep. Now they talk about that, myself not poor sleeper, but important for no say sleep they help. Overall, the body in well one definitely directly proportional and dependent on sleep. But imagine, say, if you don't sleep, most of the colleagues themselves can tell you, say, they put on weight when I begin to do nights because they eat wrongly. And they got them, they make them for let them rest na net. If now the 10 away, they go take breaks until 12, 1 o'clock, you begin eat. Clearly, not different you they put so they change in mind, they change the memory, and then they can make you put on weight. And you put on weight, you can't move as you want for move. And then, of course, one thing leads to another, then the cycle begins. So stress management, the weight gain, control that, the control of the sugar, the control of the blood pressure, and the diet and exercise go help. So I talk about this, cognitive behavioral therapy, then they not to one thing you go walk. It will take sometimes 12 months, 18 months, until in the 2 year. So you get to be prepared for be supportive counseling of the individual sense of way they or the family in general, because this is not a family thing, a whole community thing. You get to go through occupational therapy to where they work, then go assess you, then go prescribe something then for you, then go teach you how for deal with the everyday task them, for help, for lessen the pain, and of course try and avoid injury. Now make they do mandatory training. We want them now manual handling. We will not talk about that. The two will talk about the acute pain, manual handling. A lot of people can get wrong position, wrong weight, and all that way can bring about problems later on in life. So if you look after the back or the area now, it will look after you later on. Physical therapy, dandy now, as we know, the physiotherapist then can help you for stretch the body, for exercise, and do what you get for do. There were the other alternative treatment, then different one, them aromatherapy, acupuncture. Me, you can swear say that did the work because in the right hands, cupping, another one with the work, Reiki, where they can do that healing touch. So man, they work for them. Relaxation techniques, and you need to go to them place that they wouldn't do denting Reiki, acupuncture. They not get music with soothing music. He help the mind, he help the body, and of course you're able to train your mind itself. Hypnotherapy, biofeedback, all that thing then they will say, then they work, and they don't prove then say then they work. So not to just one thing, you can get a combination of everything. So somebody they ask, say, hang on, cure or day for this chronic pain? Well, sadly, I can tell you, say, no cure, no day. However, if find for make you able for identify which are the cause of the pain. Which I mean by that, try for rule out anything else where they cause the pain. Like for example, so 2, 3, 6 can they together. One can give rise to the other. Referred pain can come from the neck. Pain can come because they take codeine too much. We then call codeine-induced headache. So if you don't know, say this person take codeine, obviously you're not going to get the right advice. So you need to be assessed thoroughly and rule out everything else before they go say, okay, now this you get, and then the manager. Obviously, you're not going to left you for day in pain all this time when they investigate. They will give something for help you with the pain as they go on, as they continue to investigate. Yeah, waiting they cause them. Well, nobody don't know, but we still defend ways and means for try to look at waiting they cause them and how we go try for manage them for make we able to get move forward. How they prevent them? Well, unfortunately, nothing no day on your own where they go say this singular thing, this one thing, and they actually prevent the pain. You go able for prevent some certain sickness, some certain condition them, where can in the end lead to chronic pain. If you're able to avoid them within 12 weeks or stop them within 12 weeks, then obviously you go say you don't do well for control them, and then it don't lead to chronic pain. For example, simple one, like people where they smoke sometimes, and one patient who I see yesterday, they smoke 40. You don't do one from weight 13. Now you don't 70. The leg they're all enabled for waka. You get ulcer in the leg. Then don't amputate one part the leg them. And then of course you see you get back pain. At the same time, you don't get lung cancer now. So it's difficult, but sadly, you will say self-inflicted, but I know I'm being so callous and insensitive because I know say that been fashionable something 60, 70 years ago. However, times don't change. We can able to do something about people they can help you, agencies then they can help you for try for cut down on this. And the sooner you cut down on them, the better it is for you. So one thing I can tell people, not to think with the well forever, come again. No, it can get better, but you can manage them well. So nothing they go to say you cure them, but you can bring and count down by 30% if you manage them well. You comport yourself, you change the lifestyle, you change the diet, you exercise, bring down the weight, and of course you decrease the stress and sleep well. I guarantee you will find some respite and relief. But as I say, we know they say because we don't do this, we don't do that, we know we do. We carry on with the research and we do what you will do for try for make things move forward. Anxiety, now a big problem. Depression, now a big problem. If at all you get chronic pain, and then on top of that, on top of the bargain, you get anxiety, you get problem with the mental health, you feel unwell, you feel low in mood, you feel for do something really crazy, like you want to take your life, then I assure you, if you go to the GP or go to the primary physician, or even to win hospital, you can't we will go get somebody who will actually help you and look at you and try to guide you and signpost you to the right place. So what this can do, this chronic pain, what it can do to the person in life, it decrease the quality of the life. It causes depression, can cause anxiety. It can cause problem for people and for become hooked and addicted to drugs, heavy duty drugs them. And of course, it can be a cause of the sickness where the person gets, it actually increase them. And as I say, it can cause people and for kill themselves, which is really sad. So important for let we try as a family, as a unit, as a community, as a society, for work towards trying for stop this thing so that get to that point where it will cause people in their life. So this just to tell you no more how waiting for do biologically, waiting for do physically, waiting for do psychologically, waiting for do. But one thing where I can always talk about is this. The way people can look at this thing, they can look at the learned behavior for try for make this thing bigger than it is. Remember, I say God give you thing the way get you get but the way na painkillers when a natural one them, then call the endorphins. Then they can help. So man they get a more, so man they get a less. So man then pain threshold very high, so man then pain threshold very low. You know go grumble upon them people and they, but at least if I'm for let you guide them, for help them, for make them know what for do and how they will go through them barriers there, we go help them for get satisfaction in the quest for reduce the pain and get themselves better. So it better for let them stop what is called catastrophizing. When you look at them, you make them like big, like say, this thing that you want to do, you don't begin put the blocks now already, you not try it. It's important for make a go. But one thing I can tell you is not push yourself too far. Because if you push yourself too far, the pain stop you, you take yourself 10 steps back and you need for take one step forward rather than take 10 steps back. So you need for calibrate them, you need for gauge them, you need for see what you go for do and push yourself slowly but surely until you get to the point where you want for it. Look at this. 23% of the people that get chronic pain, then they get disability allowance. Imagine that. So it just tells you it's a big problem. And of course, so man, 50% of them will get this chronic pain, don't change their job. Instead of then they plan the job with them like with them, then train for where they really want for do, then they for do, and because of the chronic pain, now they go for actually go for do something else. And as it is, 1 in 5, they lost their job. So Boku the employer them, one and go bear with you for 6 months or 1 year. Most of them then go decide saying that we've had enough, early retirement, or they send you to physiotherapy, occupational therapy. So, but not lose heart, because as you know, if you continue in the path for get that, I'm not going to say cure, but that alleviation, it go help you and definitely go for manage and get things. Oh, also until you get a better boss or boss with understanding boss, we can actually change your job to a more less demanding one, a less physical one, where at least you go for carry on and doing the job. But 77%, they feel so depressed that they can easily end up sit them and take their life. So, what if we do for help with and that? Well, we know say smoking, they unbog people them. The weight, na the leg them, na the body can get worse. The circulation na the leg them can get worse. So therefore, it can cause a lot of problems. Therefore, try for cut down on the smoking as best you can. If you forgive them up totally, that's really good. As I say, eat a healthy diet. Exercise regularly as best you can. Not overdo them. do as much as you can, and set yourself the next goal. Again, you say push the goalpost, you achieve A, you put on to B, you achieve B, you put on to C, and so on and so forth. Remember, sleep as best you can. If you don't develop a pattern, try for keep to that pattern. Try for make sure say when you come to that term, when the body don't tire, you begin feel tired, you yawn, and not begin drag and, which is me. As I said, I talk about myself. I get for learner for actually manage that. But it's nice for make I share them with people. Manage your stress. We waiting at the hospital them, we definitely get stressed. But sometimes that stress where you could say you need for make you complete, you task them and things like that. But if they get on top of you, now make with man, then they go for their then weekend them. Then get them long weekend, they can go, then get their annual leave, take them family, go outside, go relax, outside the place warm and things, then come back, then recharge. Get away from the stress or manage them as best you can. And if you don't get any benefit from what you do you try for shame with other people then. So other people then go join this group and they will forget things going. Then go learn from you and you say go learn from them. And then, the thing will be beneficial for everybody. So this now just to make I put this together, myth them. See the way people believe we not necessarily means it not true. Like you say, me pain and the functionality, the way they do me business, where I've been the worker, I do this, I do that, I'm for doing now. It means, there's nothing they will go do. So you like self-defeatist, that's not true at all. There's always something we go do. And it can start from something as tiny as just, getting up and making the first steps. And from there on, you begin progress and get yourself better. And if you say the scan will give you the diagnosis, well, not necessarily true. It not always means that the scan will give you something, but the scan, now somebody the interpreter. You can over-interpret them, you can under-interpret them, and it can actually give you the wrong thing. But you will feel the pain, say the pain not go away. So therefore, no rest on that. Then for do further investigations, And of course, if you get the pain, you say it damage you, well, not necessarily. Because waiting to some people in the way get their threshold and very low, some people in the way they're very high. So you know me say because they feel pain, that means the other person they feel like no. But it get for be individualized, they get for be what's not the word for it? Bespoke, not for you no more, not to one size fit all. I can't the way the word now you no more if it you know fit any other person, even if now you twin, then get forgive you the one will fit you. So important for making people do that. I need for stay in bed. Well, that's the last thing you want to do. The longer you stay in bed, the more the condition they become. You need for move what you want to do, whatever it is you want to do, you need for do them. And that they lead from one thing to the other. In the end, the cycle just persists, and that definitely causes you more problems than you want to actually deal with. Bending and twisting. Now, that's our problem. We've been talking about this on the first one, whereby we no say we back them, now ain't got give you for a lift. Well, I can disagree with that because they back them, although they get big muscles, strong muscles, they're not as strong as the one the way they that the leg them, that the thigh them, that the pelvis. Now that now make God make them for let them help you. So when you pick something na ground or they push baby in a pram or you push load, you need for use them muscle here. You need not for walk away from your body. You remember the center of the gravity we've been talking about, that day important. If you maintain them, it's good for you. If you go beyond that and dislodge them, it can cause you problem. It might not be straight away, but it will cause you some time later on. And when that happens, go able for manage for say you go well straight away. And God help you if you for control them in 12 weeks. If not, well, you go fall into this group. So then why not just, they meet them where they where people and believe say you must be weak, you get low pain threshold. No. All man get your own pain threshold, and therefore you get for be according to which you feel that's what them for actually treat. You see. So waiting you go do when you reach to your doctor. You go say, you ask him, waiting they cause me pain, doctor. Do you tell me? This pain, you go away or you no go away? I go get better, I go get cured. And the doctor, if he truthfully go tell you. Waiting that the medication they will go take. And it's important at this point for make the doctor able to tell you the side effects of them. Waiting at the benefits, waiting at the disadvantages, waiting at the risks, and all the things that is supposed to tell you. So now you go begin think about them, say, man, this pain, the way they want me, I need to do something about them. So therefore, I go take them for a certain period of time and then, take it from there. But important for Leona discuss, and important for we, the doctor, then for discuss them here with you, for let them tell you exactly what's the side effects. Because sometimes then they, that will not they do and that can cause problems. You go even ask the question, say, I do something psychological or physical. And I can tell you, so you can combine both and really be successful in your way for get less pain and get better. You go ask the person, say, is safe for making exercise? And I'm sure he will tell you, say, yes, exercise as much as you're able. The more you for do them, it go better for you, as you can see. What else I can do for relieve this pain? The doctor will be able to tell you for make a plan. So just different area then get the pain management team. We don't talk about medical jamba and all that thing, and they will come into the picture. But you will start from one, you can go one to the other until you get the one will fit you, then maintain that and do what you get for do. Now the final question you go ask is, if I get worse, which I go do, and I guarantee you most of the doctor them or the nurses them, then go always tell you, say, if you get what we call red flags, you need for come now A&E to we. That means if you there, you need to feel your back passage. Also, you sit down, you need to feel that part dip on the waist. Then you know for pass water. Then of course, if the water just they pour out of you, the piece just they come up and you know for control arm, or the leg or the arm no for move. Well, then symptoms, then they need immediate attention. So then go always tell you, say, come to the A&E department. So when you come, we will do what you for do a scan and then send it to the appropriate department. So don't talk for a long time. I thank you very much, and over to now for take questions.
Uncle Doc.
Yes.
Bravo. Wow. Superb. The family and me, I get the advantage, the added advantage for being here this month, and I don't learn enough. So most of them say you don't see them before. But the funny thing, it's like that story they really cool for you back then. Now think about it carefully. Anything they tell that story, they are really to do something. Really super exciting. I could have done so. Thank you very much. I don't learn a little bit more from which I've done already. But this show not about me. So they can take questions. I can't be saying before I'm coming. You can take as many questions as possible. We try to answer and the panel really good. And more people can people know various things. So somebody must be within the panel will help us. So whatever you get to ask, we will try to ask. However, if it's too personal, most likely.
Yeah, your mic.
What I mean?
Yeah.
What happened with mic?
Oh, no, you don't come on.
Okay. I use an extended mic now.
Right.
So I go to Anne and Brian. Hello.
Good evening, everyone. Kamara, I'll be better tomorrow.
Excellent. Brilliant. I'm pleased to hear that.
I will be tomorrow, Dr. Kamara, when I have my iron infusion.
Blood.
I have arthritis. I have it in my joints. I have it in my knees, my back, my shoulders and my hands. But like when mine's painful, I have paracetamol. But I do drawing to keep my fingers going. And I go out for a little walk. I can't walk far. Walk with my stick. I walk and then I stop. And that's my bit of exercise I get. But it was excellent. I really enjoyed it. Thank you.
Thank you so much, Mrs. B and Mr. B. Thank you for sharing that with us. Yeah, we're really grateful for that. But you see, the way the Mrs. Binks they talk about, say this thing they affect the joint them, but in that stop, even though they use the walking stick, it can go for waka and get one big dog way 9 can help them for do that. You know what I mean? They need to stop, but they waka because waiting to the more you exercise, the better it is for them. And you see, waiting they take na paracetamol. You know, they go take their heavy duty drug that like pregabalin, gabapentin, and all that. They take the simple one, but it depends on a natural painkiller in brain where they help them with the walking. Yeah. And there you are. Look at me.
Yeah.
And thank you so much for that.
I have some special gloves, arthritis gloves.
Exactly.
And I actually, as they call it, I plug myself in.
Yeah.
And it's heat, and it does it really good, and it does help.
Fantastic. Super. Thank you so much.
Thank you.
Love the shirt.
Explosion in a paint factory.
dear.
Thank you very much, Anne.
Said it's an explosion in a paint factory.
No, he did.
Yeah, wow. I get another question for Mr. Davo. I don't know if we'll laugh it after me. You know, say when I get the kind of question I get.
But Mr. Dabo self there, don't put your hand up. Ask her, make you ask you.
No, you want to ask her for yourself or you want to help you? You know what I and you unmute you. Ask her what.
No,
Yeah.
Mr. Fuller, you can go ahead and ask me. Maybe get different question. I'll ask back. Wait, that now for doing statistics, and especially for with the blacks, then for them pin there.
Yeah.
You know, the disparity between the blacks 44% to whites winner for 34%, and Asians at 35%.
Yeah.
Is there anything we're responsible for that? Because it appears like for say we young color really that we more to get the brunt of the whole thing. All the sickness there, and the way one of the doctor then come up, one of they share the stats where the World Health Organization they share with we. Now we can get more of people away to suffer that way, whether na ignorance or na money or na lifestyle. I don't know which go able determine what we go request for now the doctor then for the beginning tell you about lifestyle, if not money, what we for really do. Because the whole world they get the same challenges, but now we more they get to suffer. Now that one day. And the questions are having the way in at the chat, Mr. Fuller go ask down there now, if it's possible, do a big. Thank you, sir.
Thank you, Badabo. No, thank you so much. I think the only answer I can give you, not to a straightforward answer, because there's not one particular reason where you go say now black man make black man they suffer more, because you get genetics, okay, wait until we know for pickup. You get deprivation, yeah. You get affordability. You get availability. You get the knowledge itself on how to manage them. And if you don't get the diagnosis, you not go for saying that this again. Now, I can say I just struggle with the statistics. But waiting now this issue, they know full well, say this not problem where they afflict the whole world, as I say. The only difference here is we black man, they get more affected because of certain issues. And as I say, deprivation, and one big thing. All right. Genetics ways until we know very profound at trying for get to the bottom of that, because if you day in the family, he likely say yourself go inherit the gene and yourself go get that. And then of course the other thing is, imagine, as I said, deprivation. So imagine that person where they in a farm, we all in life now, butu cut, plant this and that, the back now in, up, in, out, up and down and all that, twist and turn, bend. In the long run, it gets in way. Exactly. If now with myself, now they do athletics, I can tell you, I know one call name. One prominent footballer at the age of 38 don't get in hip replaced. We normally now around 60. Now we they look at for say the cutoff point now 60. But now with man, but he don't get you in at 38. So I need a person to get money. But the kind of work we've been doing now footballer and a dangerous footballer, he can tackle like nothing else. Actually develop this, but what I find out is he day in family. So you see what I try to say. So now multifactorial problem, not to just one thing in general, but I would say mainly now because of that deprivation, affordability, availability, and of course to top that genetics, all that come together can actually. Plus we habitus, the way we God make we, you can see we're bigger, big boned and all that, and we on life obviously needs a bit of activity. But one thing we get to in favor, we get the sun. However, if you repeatedly they do that, imagine them and midway they carry them picking them go. Picking their way 1 month, now one way to get. By the 1 year, now 10.5 kilo. Imagine you get them 4, 5, 6 of them. You see me picture. And that's the kind of thing. So collectively and accumulative, drop, they say little drops of water, 9, they make a mighty ocean. And that's the kind of thing. So it's one of those things where, as I say, not to one straight answer. There's a multitude of factors where actually they determine why make we, the black people, they do that. So no disrespect to we, but that's what is happening. Others sick the day, we then get that more than we own. All right. Thank you.
It makes sense. But even, simple examples them as well. Even that get water, we will get water, they tell we young. And I saw some of we, because of one flop, they do one quick, so we'll go play ball. This is a do They take bigger gallon for like flop quick, so I will go play ball. All them pain, then they eventually at some point they begin come back, for hunt you, Fleetwood and all that thing in there. So the question where Mr. because that I ask, you say let me say you ask if sex deprivation they cause back pain in adults.
Now more the other way around.
Like,
now more the other way around.
If you do have too much, you get back pain.
But clearly, imagine say the pelvis there, that the thrusting of the pelvis, the muscles and the lower back, they come into action. So definitely, I mean, they tell you say, do them as best you can, not go beyond that. So Mike, you want to say, if I make chawa, I'll make nyanga, as they say. And so therefore, you end up the wrong position, the wrong movement, and you end up with problems.
Okay, so the position more rather than how regular or how often.
I mean, if you definitely do them the proper way for do them, clearly you probably not only enjoy or benefit from that, but you then say they overdo them to the point where you say imagine you're exhausted. This is the thing why I try to tell people that, you think about it, you're exhausted, right? You don't day sleepless, and then all of a sudden you want to go begin pull name, and you don't old 60, 70 years. Well, I leave the rest to your imagination. That's the kind of thing that they talk about, So do what you get for do, but make sure say you tailor them according to your needs, rather than for go begin say, this girl, 30-year-old, they will see back. Doesn't work, because at the end of the day, now you go pay the price. It's as simple as that.
Okay. You say if you do it the proper way, I will hang that point they may go talk about that.
That's okay.
We'll talk that offline. You say if you do it the proper way.
Well, yes.
No worry, I'm not gonna ask you. Auntie Monica. Auntie Monica, over to you, ma'am.
Yes, yeah. Good evening, everyone. Thank you so much for the first time I don't join Una, and I'm very happy. All the time I can miss them, but as soon as you put them up, I'm gonna put it on my alarm so that it go alert me. So thank you so much. You guys are doing fabulously.
Thank
well.
you.
The one that we always in hospital do not. Doctors, and a lot of people that within us who know me. And I know say I'm always poorly, but I'm very strong, and I try to be defiant to within the doctors that they say or within me body they tell me. Because I don't believe for say person for just say I know well. You get for do something like against that. And when you try for 5 times, you do ruin the body more. And that's, I think, what I've done to myself. So now I don't reach the stage that, like when doctor, you talk about this back pain, say, for the dome. For me, it did help. I think 2 months ago, after like 5 months, I did get this back pain. They're able to tell me what it is, and they able waka and everything. Then do MRI scan, and then they realize, say, me joints and my spine also dehydrated, and then they cause this very bad pain in my back. And I read certain people there, article about pain relief and everything. One is saying they don't have bed for 1 month. And I did that, and I'm not lying. It helped me more than waiting the morphine do for me. Like when doctor, they talk about having this painkiller and can lead to something else. I had a very nasty reaction to the morphine, and it didn't help me, but it helped and it didn't help me. So how me to do them now? At the base, I'm on the level of pain. If I can go in a shower, I go have a shower, a warm bath. If it helps, fine. If it doesn't help, fine. Cocodamol, tramadol, codeine, this, that, it doesn't help. The only Panadol with the help that the dissolvable one. But that enough suits me because of the high sodium we get. I'm in a high blood pressure patient. The only thing I want to ask doctor now, because me they manage the vacuum problem, is related to arthritis. My fingers there now, because now I'm an events planner and decorator, I find them difficult to do balloons now. Although I believe that doing the balloons was gonna help me, But now when I wake up in the morning, fingers them, they get very different feeling or movement where they look the hand themselves now different. Then they dance jiggle. I put them in a nutshell. And then I go for go to make a help myself for just wash my own cup because I tend not to do nothing in the house. My husband helped me a lot and the kids are helping me. But I tend to do just a minimal. If I say, okay, I decide for wash my own plate and my pan, or my own plate or my cup, I'm telling you, the moment I put my hand in lukewarm water, it is send electric shock per me. So I don't know which thing they cause that.
Okay. Thank you so much, Mrs. Kamara. We're grateful to you for sharing, the problem, the way they go through. It's good for Yeri. He touched on a few things, and I think say all the things they've been to talk about, he actually bring them come to light. He talk about waiting suit them, waiting work for them, and waiting no work for them. This is the thing that they talk about. As I say, like they say, when he lay down a bed for 1 month. Now I don't know if now 1 month, 24 hours a day, now he go but down in the details of that. But the fact remains simple. I can even tell you, say, if you get acute pain, now you lay down supine, i.e., you face the ceiling or the roof, and the pain not get better, that na a bad sign. If the pain the worse na net, they wake you up in the morning, that na a bad sign. And the signs that I've been telling you about, where you get that problem where you know for move your leg or your arm, or the way they come out from you where you know for control them, or you know for we at all, or you know for feel your back passage, then they did the red flag signs and we definitely need for come hospital for. Now, the other thing we go talk about is the pain then where they say you feel like the fingers them. Then get specific arthritis where they affect then joint, then they mainly. So in effect, now for find out who's swamp and them. It's possible say now not even rheumatoid. You can possibly see whether this thing we then call this thing we then get for use electric, like how and they talk them. You put electric glove them by himself for EPAM so that they loosen up. Because they call them Raynaud's. Now Raynaud's phenomenon then get the one way now one way you acquire and the one way you go get because of other things than because of your job or because of which you they take some medication they then get gout which can affect the day. So if somebody go na cold, it can actually ambogam. So definitely you need for get something for EPAM. But that 19 way then get for tick the boxes then for rule out any other thing. So if they don't try for investigate, they don't forget to the bottom of that. I sure say somebody like a rheumatologist will be for help in this particular situation. If at all you're not able, then they can get the pain management team. We go actually map out with you in the center this pain control plan. We then go for the execute from time and time and again when this thing they get worse. But if the staying in bed works for you, that's fine. But what you don't tell me will work is that if you go get a shower and if you say you're able for carry on with that naive, you get yourself to the limit. You need to go beyond that. You see what I mean? So in effect, not to one cap fit all. It get for be individualized. Now, I say me and you can talk privately if you want, and then we can see what you will for do. But it's important for make you not say you don't do well where you say morphine no work for you. So now you just there on something different, but then you carry on with the life and you do what you for do, and you feel still fulfilled to a certain extent. Your husband there for support, which is the other thing why they talk about. This is not just you. The counseling not just for the person who is sick, for the whole family. And of course, support group then they where you can join, where you can share ideas as to how they cope, how they do, they manage, what they get, what kind of success they get, which you can copy, and which you can bring to the table to go up to other people. That's how we do this thing.
Thank you very much, Uncle Doc. If I'm Mulem, like I've been promised before, there's a survey where they go around. Please, dear, we go appreciate your input a lot. Number one, if you rate on 1, it means that the lowest, and number 5 will be the highest. So if you feel say the session not so good, you rate on 1. If you say the session fantastic, you rate on 5. If you say, well, maybe there's a room for improvement, you can rate on 4 or 3. Okay. I come to Auntie Memuna, but also want to let somebody, mommy, let mommy know say I don't see, and I will come to them after Auntie Memuna. But before I go to that day, somebody asked the question where I think you don't cover already. But should in case maybe the person missed that side, it say, what is the cause of chronic pain? I don't think you don't cover them already. So for example, if you have pain that side at the slide where at some point you will go back to and just for explain to that person, maybe a join way a bit late. So they are the axis, they just go over them a little bit. Okay. So I'll count to Sister Mimuna. Sister Mimuna?
Yes. Now, good evening.
Yes, ma. How are you, ma?
Yeah. First of all, I want to say plenty thank you to una all. We come together for put this program. And within Doc don't say that this program, no lie, no day. And we all they go through that. But one of the things like with me, because as soon as he put her on, when he mentioned chronic, I decided, say, well, this I get for, although I can watch listen to the program, but for one reason or the other, I don't miss few presentation, but this was I try for make sure see a day. Like me own pain, actually, it begin during the COVID time when I be the work from home. I be getting serious back pain on the left, the middle side from me back, take on to the foot. But I be talk to Doc at one point about that. So he gives her advice, and if they work, the advice is with regards of working. So I changed my job, where this I not be the work from home again. I begin worker, and he helped me because even I get the opportunity. Say last year, well this year, yeah, December last year, I be able to go to Mecca. We cost. Oh, I don't come out. I still there on.
Yes, ma'am.
Yeah.
Okay, I see. Yeah, we be say I be able to go Mecca. I be able to do like then 20 to 30,000 steps for the day. Wow, so impressed. But this BNTM, it really don't come back. The pain don't come back. Where me food they just give way. But one thing I noticed, I for done recently in September, so I don't know if I don't trigger and back. Where we say the pain can just you can just feel like somebody they pull you in between, then you give way. Like at times I want to get off from the seats in the office and they feel this sharp pain in the middle. So I don't know if na the for them, na I don't bring them back or na the pain don't come back. We be say the pain can go on and off. But I buy this thing recently. I don't know if the video will able to show. Well, I will show people if they can able to try them. I'm not able to see the video. They go. Okay.
Yeah, if you find the video, you can share them the link.
Yeah.
Other people then go, at least other people go come and benefit.
Okay. Sometimes not 10's machine now you don't buy it sometimes.
No, not to. Now one thing.
But one thing where you say, is that you find them very beneficial with the advice. Alhamdulillah, you go to the Holy Land, you do 20, 30,000 steps, which is brilliant. Now somebody, and I think say HRH anti-doc na input say doctor say we make you go in a hot country. All right, the heat that does help.
Yeah, so I feel say that they really help.
That's not one thing.
Yes.
It does help. As I say, now we don't go into the cold season and up and down and things like that. And to top that, you get something way trigger and way push them. You for dumb. Now after you for dumb, obviously you know nose damage you do to your back because you don't go let them go assess you. I guarantee you, if this thing they carry on, then the best thing to do now will maybe get to the GP, and I'm sure the GP goes select they do another scan where then go compare what you get now compared to how it been done previously to see if there's anything else don't happen. Especially when you say the leg they give away, which tells me.
Yeah, because now then I'm fear because I can still the worker even now I did do like then 10,000 steps.
Which is good.
But I don't cut down them few weeks there because I'm afraid. Because from when my leg they give way, I know I'm gonna go for them.
It wasn't enough. Yeah, it wasn't enough, definitely. Yeah. So now make you do what you're able to do. But I mean 10,000 steps, not to Boku people able for do. I can guarantee you that, even half of that a day, not bad at all. That's absolutely phenomenal. It's good. With the pain, and I say that's not the thing where they happen. You set yourself target, you go achieve the target, and then push yourself slightly beyond that. achieve that end goal. As I say, changing the goalpost in this particular case helps tremendously well. But remember, get yourself checked. Let them send you for an MR scan, because the leg giving way means there's a nerve way involved by this. And normally, now the bottom one, when at the L5, S1, the bottom of the back, now 5 bone, they may get separate. And then outside the seat bone there, now 5 combined and then fused into 1. So 5 plus 1 makes 6. Now outside the lumbar spine, the lower back, they turn the seat bone, the sacrum. Now this thinking actually happens. So now L5, S1, now this thinking normally happen frequently. And maybe now that then go find out when then do the scan for you, and then of course then go for manager. Hopefully, with any luck, inshallah, you go forget to where you've been there before, if not even better. But it's nice for let them manage you in a way where they say you will get to the bottom of waiting at the cause of them.
Yeah, because they make Cocodamol no fits me if I take her the each me body badly, so I
exactly. So the GP get for fence until we suit you. Now cheap drug, as it were, and I think we easily can get addicted. So then can do them for people generally. But if you get specifics way for take them because the body they crash, then clearly they need for change into something different, something way go suit your body. Now make I say not to one size fits all, na bespoke, na team way, order the cap fit, na so you go wear them. It's as simple as that. So waiting them plan for you with you in the middle is important.
Okay.
All right. But you don't do well.
Okay.
Really good. Thank you so much. Thank you.
Thank you.
Regarding the causes or the factors, now that I don't show you them, I look at them.
Okay.
The high heel shoes,
No, then I don't left them.
the begin make length,
No, the
ergonomics, as you can see, poor mattress. That's another thing, So mattress, so man no say you get for actually invest in a very decent mattress and for change them every 2 months, change the position, top to bottom, because we can do the body, they make a dent in that, and the spring don't go. If actually can become a source of pain, and that can cause you more pain. So if you get a proper mattress, so man can get that orthopedic mattress or posturepedic mattress, then they can help.
And today exactly now that I do. What I tell you, I say no, we need for turn and over. So how that's exactly so because somebody sent me a WhatsApp message and then and that's I do first thing this morning. Now say no, we need for do this bit.
Fantastic. You tell them. That's really good. Yes.
Thank you.
Thank you.
Thank you very much, ma.
This thing I be one show, but I'm not able to see them because I they use them for laid on. It when you press them, it feel it feel like you pelvis they draw where you lay down now like square thing.
All right, okay. I know what you mean. I know what you mean. And then the advertiser and like where they draw like a string panam, you put them, and then they begin pull you and stretch the back for you. Yeah, I know what you do. Yeah.
Yeah, so then the back look helpful.
Yeah, no, of course. Now, anything where for stretch the back, you can do it with the physio for help you. You can do it on yourself. I can tell people that if you lay down at your back, now you lift the knee towards your chest if you're able to do that. So the knee flexed, the hip flexed, bring them, you hand them there on behind the knee them and bring them towards your chest. They actually relax the muscles of the back. And one of the muscles that we then call them erector spinae, the one with the straight in the back. Then they can go into spasm where it can make people stiff when they for do anything. So therefore, if you stretch that one day, if fine for leg, don't take some painkillers because some man that pain and can put them off now forever. So if you don't take something, we go at least lower the pain. You stretch down there. I guarantee you within 15-20 minutes. Not me say the pain go completely, but at least it go ease them and the spasm go wear off, and that way you go for carry on and do what you for do. Again, posture, that big issue. Because when they get the wrong posture, they begin feel the pain straight away. It will take you some time. Then one fine day, something happen, boop, like that. You just go and then you get for then recover, and the recovery not to one day. You get for take some time for go back to side in there. So that's the kind of thing.
Hey, Uncle Doc, we talk about posture. You know, see what stretch to it. That be bad habits, Andy. Don't hold and stuff. Something you can forget yourself. You just try to find a way for just.
Yeah.
My family towards the end. But we get somebody else on the we want to ask questions. We get mommy. We get somebody else to send a message by text, and we get Antitata. Antitata, do you allow go to mommy first because it can't be done there before you. Then I'll come to you, please. Yeah. Mommy.
Yeah, good evening, everybody. Doctor, thank you. All thank you.
Hey.
Me from Lenez Naoti. I know say no say I mean that's it. I saw the today. No, that's me. Doctor, to God. I see when they said this and I have myself put on my calendar. I said this. Although I miss half part, by the time what take me phone now. But anyway, what's it? The first question is, Doctor, when you they give epidural in time of labor, you they get back pain?
Yes, it's possible say they can make mistake and something can happen, you can get pain, definitely. No question. Because you see, the epidural, a lot of people don't know waiting the influence and waiting they make them do them. I know disrespect to people, but the one way not get boku, what they call adipose fat in body, easy for access, and then thin small people like you easily get that role. The one way get body, sadly, you always get body, then can fiddle with and then can get for fan because what you do, you get for go through a thicker layer. And sometimes then they, it's possible, say like they say human error, anything can happen. But yes, it does cause that, definitely.
Yeah, then you just wait for me. That's how we they talk about be outside okra. So I don't put the okra one eat. I'll get for put the plate down first. Doctor, me this pain yeah, because of I don't get say I don't get 3 accidents in Manchester now. But the drug the word 3.
Yeah.
3 accidents have don't involve.
Yeah.
But it's like especially during winter. In the morning, most summer they come, you can see me they go up and down. I can even wear high heels. But during winter, where it don't cancel, Nike the money. But it's like even recently, the GP called me for review me medication. I still take. I take tramadol, but not all thing. I take tramadol, omeprazole, and naproxen.
Right.
So, but I can mix and sometimes paracetamol, but not to all thing. I know they take a pass at the pain. The money.
Exactly. That's the good way for do them. You take them when you need them. Depend on your body.
I get bed warmer. All the
place
close, I get bed warmer. I get water bottle.
Exactly. That's it. Well, look, we did a bit. So remember for the stretch the back as well. Just
when this pain can come sometimes, I know they bother for take medication. If I not get appointment, it make me self and I through what you talk. Because even if you get job, this pain they make the employer then can always say what he said.
Yeah.
I don't know 2 to 3 jobs from
that. They frown at you, then begin for trigger that policy. That disciplinary, procedure. For CC, then go send it to OcuHealth, and if you're not fit for the job, then that either sack you or retire you on ill health early. They can do that. Now it can cause problems because it's a big thing. It's a big thing. I say 800 million people they suffer with this. It's big. No questions about that. But when you do well, say you take the painkiller only when you need them, and you pinpoint and say now winter night they suffer more with them than the summer. So that's a good thing. The only thing is for go salon during February, March, April, well, almost into 2,000 pounds now. So you got to think about that. Maybe you better let you stick that to European countries way warmer as well.
Like I get bed warmer.
Yeah, it's good.
Yeah, it help a lot. Sunday work in bed, I use water bottle.
Yeah. It's good that. Yes, definitely.
But yesterday I been try for go na my backyard. I misstep. So this my foot will been broke. That pain then day been there. So later that evening, 10 and 8, say this morning, it can't up my spine. I feel that. Oh yeah.
You don't jar the spine. That's what happens. Now you think that. So now it's a question of trying for get them back to side in day, which will take some time. But if you manage them like how you don't manage them, so you should get there definitely. But as I say, take the painkillers when you need them. Not to like out man they take and say because
pass I need them. Seriously, pass I need them because on the paracetamol more they take or I use African rub they don't need.
Yeah, it's good. That massage helps a lot. It helps a lot, definitely. No questions about that,
Because like especially tramadol, I'm afraid would
not that you good, addictive, and it causes a lot of problems, But if you're able to avoid them, that's fine. If you need them when you want to take them when you need them. Then after that, cut down on them. It's as simple as that. But you get for be in control. That's not the only way you go for get yourself out of that cycle,
Yeah. So it's like one day I go to my GP, say they can say they would have medicine, for taking them with empty stomach. So now I go explain, give me GP. I say, but why they not for take an empty stomach? Okay, get for explain it. I say, but this one I just don't eat fufu. Say, what is fufu? I say, but now heavy.
I will say you don't need an excuse for eat.
Yes.
No, it's like just a humor. You get sense of humor. Now I say, he said that in a heavy weight. Now I say, boy, doctor, I get for it. They say, I said no. He said that light food for Iki. It's bread. He said it didn't just for prevent use.
Yeah.
Well, anyway, yeah. Thank you, doctor. Because
thank you so much. Yeah.
Much more for your contribution.
Thank you.
Antecessor, I get a question on the chat, but I will go to Antecessor first. If I remind you say you're on mute, I will charge you.
Thank you, Mr. Fuller, and thank you very much, Doctor. This is a very, very good session. It's so, educative and a lot of information. We are not know, but much of those. So I get a quick question about sleeping. Like we could go like days or weeks. We're so busy, we need to sleep better. But maybe don't read some size say, if you not sleep very well or long hours, you can able to catch up on your sleep. So I can find myself to do that a lot. Like if I be very busy during the week, then I know say weekend, I don't get much for do. I go just make sure say I sleep a lot for catch up. So then they can get any effects, like on the pain or, knock wood, I don't get any pain anywhere. But, just thinking like, because I can go days and then they sleep better. If I get something for do, I will take from work, I can host, I continue for work, sleep very late, very short hours, get very early in the morning, go back to work. So I just want.
Thank you so much. Thank you so much for that. The confusing thing that way some man about I think we'll not talk about sleep at some point. One of the program they will talk about sleep. Yes. Then get ready and call REM sleep. We're not the best one. Now me say you get for be 8 hours. Now this is not the misconception. A lot of people think say pass you get 8 hours. You can even get 8 hours sleep, you still not get the quality out of them. If the quality sleep now 4-5 hours, you definitely now make you see then country them like Western Europe, like then Mediterranean, Italy, and places like that, Spain, then get the siesta between that 2 o'clock to 4 o'clock. There's no way you will get them out. Then they cut, and then can they say that power nap is very, very important because you get the quality of the sleep you want. So again, ideally, if I let you sleep the net. If you not able to sleep, as I say, no go sit down in a room and begin play with the phone, the TV, and things and all that. If you don't get a time, as a regime, a pattern where you need to follow, stick to that. Because the moment you interfere with that, and then you obstruct them, or maybe you make them different, you just interfere with them, and then of course they begin then tell you. I tell you, like me, I not do nights for 12 years. Because we say I go do nights, my body clock change completely. I need now 2 weeks for recover from that. And now I not get that luxury today. So therefore, even when they call me for do nights, even if I next strike here, I need to go do them. Because the moment I do them, my body they change. My mind they tell me say na daybreak, my body they tell me say na time for sleep. And that not they help me at all because I'm a poor sleeper. And so when I sleep well. When I wake, I carry on and do it every day. But mean say you can forget that 8 hours and more sleep. You get the quality sleep, even if it's short, 4-5 hours, that is enough for take you over. I hope so that doesn't make sense.
Yeah, it makes sense. And that if I can find out, say like 4 to 6 hours sleep enough for me. If I sleep longer sometimes, I feel tired,
Exactly. Counterproductive, yeah.
Yeah. So the other thing about pain is if you get a neuro reprogramming, that no go help with pain. Because
Absolutely. Yeah, as I say, sometimes it go work for you, sometimes it not go work for other person. You know what I mean?
Okay.
So what you they try to do is find that thing where they work for you.
Okay.
And like how you know people know they share their own experience them. So man they say they wear gloves, so man they say they work out, so man they say they put that in corset kind of thing where they pull the back. You know, all the different things they all day and this like the watch show. They all they work, but not for all man. It's a bit like when they tell you say this thing, that what you call it now, the COVID vaccine. Now for all man. Well, I tell you what, it's not possible for the all man taker because for man they will get allergy to that component where the vaccine get. Therefore, if you get that bad allergy there, what you make I forgive you and where I go cause anaphylaxis where go make you die sooner. So therefore, not for all man, but order for take them. It's as simple as that. So one cap does not fit all in this particular situation. Literally, you get for friend the one will fit you, the one will suit you, the one will work for you. And if you work for you, stick with them. And if you work for you, then maybe share them with other people and ways until they know about that. Let us have benefit. That's my message on that.
Thank you very much, Doctor. Thank you.
You're welcome. Thank you.
Okay. I get a question on the chat. They ask about some kind of diet and say they don't tell them say if they eat peanut or okra. Use if you treat for eat peanut and okra if you treat if you get arthritis. Is that true?
Oh boy. Well, I don't know. Maybe it's for Fatima if you be there, so tell you for Charlie.
Exactly. I mean, which part I don't see him so.
But as far as I know, I don't know what's medicinal about peanuts and okra. I know say some man they talk about okra, the medicinal effects and this and that, but I mean that lady finger there or slippery, slimery. I'll be honest with you, I don't know what's the medicinal benefits of them. But if anything we go work for person, I can always tell people as long as it works and it's not detrimental to you, because
in this case they say they're not for use. If I understand the question well, they say they're not for eat peanut and okra. They're not for use if they get arthritis.
Now make I say I have seen nothing on the nutritional benefits of okra and peanut we contraindicated when you treat arthritis. In fact, the question is, when you treat arthritis, which do you treat her with? Now tablets or now waiting, or now therapy or whatever. So that is not clear. A bit woolly, a bit ambiguous. If you tell me say the person they get treatment with certain tablets and the tablet they interfere or interact with the okra and the peanut, I can understand that. But if they say treatment, well, you not tell me how they treat them. Because it can be say now electricity they use, the TENS machine. You can't tell me that they interfere with the peanuts and the okra. I don't see how that's possible, But it's nice for that we're able to forget the question better, maybe but I don't know how we link. I must admit, I can take them and talk to Fatima until we get out the answer and then supply later.
That's what I for. I'll pass on to Fatima. If the person you see the link to the WhatsApp group, I will say please join the group so at least we will provide an answer to her. You able get them or join the next program. We will try for answer than before we start. Somebody else, sorry, Kamara, I say they ask if something they cause headache, but I don't know exactly what they refer to, whether not the okra and the granati they ask about or what, I don't know. So if you try for put a question or maybe raise your hand up and ask a question for you, try for rephrase the question, I will try for understand them. So I'll go to OTTF. Please do introduce yourself. Old time family something, I don't know.
Family and friends, family friends,
Okay.
Hello.
How are you, sir?
I'm fine. My name's Saliu.
Okay, how are you?
I'm fine. I want to ask one question. Sometime in the way they feel me back, like from me neck right stand on to the middle of me back. But somebody be advised me make I go sauna. I go there 1 or 2 times, I feel say it better. Now, waiting at the advice for doctor for make whether I continue with them or waiting.
What do you do? What do you use to make it better?
I've been get for end up for the go sauna.
Yeah.
you know the sauna, the hot bath.
Yeah.
So when I find out the any tower commodity, it is better. But if I don't like after like 1 or 2 weeks later, I know goodie, the thing they sell for camo. What now you advise?
Well, I mean, as I say, it work for you. Then maybe you do every week. If you never afford to go every 2-3 days, maybe do them every week. It work for you, that's fine. I mean, the sauna getting benefits, definitely, no questions about that. What you make them, they do then get that Turkish contrast douche, you know, where you open the arteries them and the blood vessels them to the body, where they get the blood for going at the area and help for pull whatever stuff the way that can cause the pain. Then they can help for heal as well. And the sweating can take out a lot of the toxic stuff we can get. Plus, of course, they heat the body and that keeps you healthier. The same thing with acupuncture and that cupping. The cupping get heat by now. Where, as I say again, if they open the area outside the pain there for allow for let the blood go in, and when the blood go in, it take away all the bad bits and bring about the new bit where they give the nutrition, we go help with the healing. So if you do them on a weekly basis, perhaps that would be good for you, like how you don't find out. So maybe carry on with that because it will work for you. As I say, if you not work for other person, then of course you get to look for something else will work for them. But if this they work for you, then maybe it will cost you a bit of money, but at least the money well spent. Because what you do, you look after the health and it causes you less pain, and then you're not able for absent from work because you're able to do them regularly, which, as I say, team beneficial for you, like a win-win situation. They make money, you say make money, at the same time you feel well.
Thank you very much.
You're welcome, my brother.
For advice on that sauna a bit there, some gym then can they we can get part of their service. So if you get a local gym there, you can service, then you might also find the 250. I don't say more benefits for your buck. You know, you get more service for your money. You know, your local gym now, so for example, get sauna, so I can use them. Okay, thank you very much, sir. Uncle Doc, before we sign off today, I just get 2 questions for Ask Quick. One, now on the issue of pain and aging, people feel say as if we expect say as you get older, pain for be part of it. I will only give you 2 minutes on that. Now one. The second one now is pain linked to weather.
Yeah, we don't answer that. We don't talk that already.
Only 2 questions and they were.
Yeah, we don't talk about say the warm weather. Actually, we talk about sauna, like heat. You know, being in a warm country. You know, definitely people they benefit more from that. So man can say, wow, go salon during the summer, like then February, March, April, May. I don't feel one pain. I come back in a different thing. You know, this is just a natural thing. But of course, if you're in a temperate climate, you tend to suffer more with that than when you're in a tropical climate. It's as simple as that. The heat, the sunshine.
So when it comes to pain, you know, as we get older, we expect.
And they come to that, yes. And they come to that. And I can tell you, research don't prove, say, this, quote me on this, every 50-year-old spine, I repeat, everybody who don't turn 50 get some amount of arthritis in spine. Some more, some less. But definitely some amount of degeneration, they take place because we can do a couple of things. The disc, that cushion, where we get between the two bone them. Imagine the one then at the neck now 7, the one then at the chest and the back, middle back now 12, the one then at the lower back now 5, and then the seat bone now 5 fused together as one, and then the tailbone about some man can get 3, some man can get 6. So in total, you get about maybe 29, 31, depending on 33, depending on which you get. However, between them, then each and every one then gets the brisketia, like we can say on the animal. Yeah. So now the cartilage down there. Now this the way na cushion. I get another other presentation and for easily bring it to, but I not get chance for bring. But today, so that cushion there now like eclair. Then they eat sweet. Then get that pulp like the middle. Then the other bit now fast into the bone. So as the person they grow older, this soft bit they get drier. And if you dry, so the lubrication will be they provide no day again. That softness and that rubbing of the bone on the other begin to take place. And imagine bone on bone. That they cause the pain. So one way or the other, we all they get degeneration, not just that the way of life. You know, because if imagine, say, when you've been there at the age of 15, 20, you know, be need glasses. Now, all of a sudden, by the time you reach 40, you look at the writing, the thing begin go wonky. You know, then that means you get to go to spec savers. And in fact, we black man them at the age of 40, then get for check you for see whether you get acquired glaucoma. I mean, like me now, I not been to wear glasses. I can see you now, but if I come before the computer, I need to wear the glasses. And it tell me say the chambers na the eye, na the cornea in narrow. So now then they look at me, say possibly say I can get glaucoma, which is very rife amongst the Afro-Caribbean people. So at the age of 40, I advise every black person, be it Caribbean or Salonian or whatever, go get your eyes checked, because they need for look at the blood, the eye pressure, intraocular pressure, and of course they need for look the back of the eye, the retina, and for see waiting the possibility of you developing glaucoma. So not just something to do with aging. So everything they age. You see, we'll not digress, but look at here, the temple. You know to make them call us, oh? The Latin name, I can see me teacher. I don't know if Naim, I can see me teacher. You know, so Naim. the place, they call this place the temple because they name them after time. Temporo. Temple. Now they call it temple because now they force the weight here they come out. Normally, 40, 45, 50, you expect them. But some man now, you don't turn fashion. 20, they don't begin get it. That don't mean say they're old, but there you go. But now age, you associate that gray hair with.
He look nice.
Well, it is.
You never be like man for that. Look, I say, you cute, man.
Oh, look at that. My brother from another mother.
Okay, Mr. Holland in question or in contribution could be the last one. You know, for Una, we know one turn 40, and I'm not going to for tell people and say, no, I'm only 32. And that's all right, still. That works. Mr. Holland.
Hello, guys. Wow, long time. Happy
My brother.
New Year.
Oh, boy, you're very welcome.
I'm driving, but just the thing is, I don't know if you can know about Dupixent.
What is that, sorry?
Dupixent, the medication called Dupixent.
Okay, it's even I named in America, they're different from we on the Nayana, it's in that, so.
Okay, but it's been a miracle for cosmic asthma, which is chronic.
Right.
And since I've been on that medication, I think I told you about that in 2019.
Yes.
My breathing is better, and I think it reduces the mucus, which reducing of the mucus helps. I don't know if you guys can research that, or because that is an expensive medication here in the US, maybe be cheaper in London.
Right.
Yes. So now that's a one for adding. Thanks for all you do. And let me get a chance to put me comment. I appreciate you all. May God bless you all mightily for what you do. You guys are the unsung heroes, and we praise you.
Thank you so much, brother. It's good to hear you. Thank you so much. We'll catch up later. Thank you so much.
All right.
Thank you very much, sir.
God bless.
Okay, my family, una plenty thank you. We don't go well over time, but I'm sure una all we don't stay. I'm sure you don't benefit from this. When I look at that time well spent. So I go around the team, please, guys. I'm sorry I do them again this week for saying I try for make una goodbyes very short. As I know.
TM, sorry, somebody said he just asked a question. Galaxy something.
Which one?
I think that the last question I just heard in flashing.
Thank you. My question is: there anything known as seasonal pain? You know anything they would call seasonal pain?
Seasonal pain. Well, we just talk about that. As I say, some man they get pain because of the temperate conditions. Some man they feel better when they go in tropical conditions. It's as simple as that. Now, whether it's psychological as well as, therapeutic or maybe medicinal and all that, that's one thing. But it differs from one individual to another. But as I say, definitely some man, they feel worse when the cold day than when the heat day. Imagine, say, the cold day, therefore, because you cold, you they tremble, you they shake the muscles, you they shake the bones. That in itself gets an effect. So one way or the other, lactic acid together, now the muscle, now the body, and that can cause you pain. No questions about that.
Thank you very, very much. If I'm gonna be and I big at the big, I'll go for forgive me. I will get for end. I go around the team quick. So I get Dr. Bell, I get Dr. Rashid, Atita Fuller, Dr. Toure, and Auntie Nafi. So Dr. Bell, I give people a final word for today. I know you're not hearing from you for the whole day today, but please.
Yeah, good evening, and Dr. Kamara. Thank you very much for that presentation. Very, very good presentation and very important presentation as well. I'll get two things in number one talk about. The one thing I want to talk about the weather and winter and summer. Therefore, we can also say vitamin D, they play a very big role as well. So we black man there we in Europe and we get vitamin D deficiency. And I will always advise all black men the way they in Europe, for instance, for take vitamin D, maybe in America as well, especially in the side that we get a lot with the winter. We have six months of winter with the place can dark as well. We get a lot of vitamin D from the sun. So vitamin D very important. Secondly, headache. You get a lot of people, especially in Africa and South, we get a lot of headache. They can say, I get headache. I go to a doctor. I go to that nurse. They go give me drip. As I get the drip no more, I don't get the headache again. And I assure you, say, if you be drinking 2 liter water, that same thing will happen. So, and the one thing that a lot of people don't understand as well, they always repeat at this program here. So, say salon people learn for they drink at least 2 liter water per day. Normally, especially at the one dry season, 3 liter per day supposed to be the minimum way people in the drinking salon. And I assure you, if you drink 3 liter per day, definitely your headache will go. So please, wanna take that into consideration. Always to drink water. We go wet in a toilet. You find out say you urine concentrated, you dehydrated. You get for drink water. Very important. Women and pain. Then a one old topic, and you are not going to start on about talk something about that. But I know it started. But women and pain. We ask women say you get pain, you say the pain normal. But there is no normal pain.
Absolutely.
But women can always say that pain is normal, not normal pain. But women in pain, then we go talk another day. For your body, better past
don't worry. I don't write a note. I make all me pen and still have the right. Don't make it topic for you know what I will find a date.
Thank you so much, Doc. You make a valid point.
Yeah.
Vitamin D, essential.
Yeah.
Most of the people don't know say they lack them, but it's important for you to top up on that.
Yes.
For me, I did use them for the past 4 years. I did use them every blessed day. In fact, it'd be important during the COVID to add to that. That now one thing we save a lot of lives, vitamin D. So I advise people them that 1,000 units in a green and white box, one every day, then they could be useful and beneficial to you.
Yeah, definitely. Yeah, more than me see then diagnose me say I be get deficiency. So they put 4 months madness, some heavy tablet now, right?
Every black man gets them.
Yes, true. Yeah, now because of the melanin, we determine the complexion of the body. Yeah.
Thank you very much. Dr. Rashid, I don't know if you're in a position for talk. There are a lot of information short, yeah? Yeah, Dr. Rashid.
Good evening. Dr. Kamara, plenty, thank you for this important talk. We will stay at the chronic diseases for a while. As Dr. Kamara said, the lifestyle, the diet, got a lot to do with chronic pain. So, Fambuda, whatever they do, way suit you, way they fit you, stick with that. Waiting off you to left out. Thank you. Thank you. Everybody, get a pass gentry.
Thank you very much,
sir. Doc.
Thank you, Doc. Yeah, Dr. Tuge?
Yes, Fambuleona, thank you for joining me today. And thank you so much, Dr. Kamara. You don't really exhaust and...
Tell me, don't freeze.
Honestly, you don't really... I freeze? Do you hear me?
No, you better now. You better now. Yeah, you okay.
Yeah, you don't really exhaust this topic here. You get a whole department where they deal with pain. So let's see how important it is. So I think the take-home message here is that you do within the work for you. 1 and 2, the too much reliance on medication can lead to so many other problems. And I'm glad with the feedback word that people in Guinea say medication not to the answer. It's just just a quick relief in the give, but for chronic pain, if you're able to do all the other things the way Dr. Kamara talk about, you know, from the exercise, the TENS machine, and all the other things that you see it fit you, you work with her. I think then they go help you more. And the people who talk about the okra, peanuts, and other vegetable, with them vegetable, and they get vitamins and so they get B3, so they get calcium, you know, and vitamins as well. With them vitamins, and they're helpful for the body and the bony self-information. So I don't know how they will say, you know, if you get arthritis, you know, go take the medication and they. But we know say that they advocate for fruits and vegetables, you know. So I mean, your diet, exercise, and everything we don't talk about. You can go again at YouTube. This session within at YouTube. You can go and revisit some of them things and again, and go help. If you exercise as you able. That's done at the key thing and the. Okay, so until we meet again next time, we will say. We all know say well body health is wealth, well body better pass gently. So now thank you for wanna join me.
Thank you very much, Dr. Toure. Auntie Nafi? Okay. Aisata?
Thank you very much. Again, Dr. Kamara, a very, very good session. All we go and say is people, the way they work very long hours with a computer, where they sit on our office, at times we they lose with posture them. Me are very guilty of that. So we just therefore pay attention to that. You know, make sure say you get up, you know, frequently, take a little bit of exercise, mind the posture. It's very, very easy for just sit down and focus on the computer. You know, they think about anything else. Yes. TJ never do that. So it's very easy for just focus on the computer, you know, think about anything. I'm very, very guilty of that. Let me make talk. So as Dr. Kamara does say, that is very, very important. And as Dr. Bell does say as well, drink a lot of water. Again, you know, you need to be hydrated. You know, make sure it take you 2.5 liters per day. Now, Daniel, no matter for add, Dr. Kamara does everything, and my colleagues herself, they don't add a lot. Thank you very much. As we all know, well body, it better pass gently.
Thank you very, very much. Auntie Nafi?
Yes, sorry, everybody. I will say thank you, Dr. Kamara, for that wonderful presentation. You jogged my memory a lot. In fact, something itself new to me. Thank you, Dr. Bell, for the vitamin D advice. Myself, I think I take 4,000 IU every day.
Wow.
Because I suffer low vitamin D even before COVID safe. The presentation be really, really nice. I see it's a hot topic because a lot of questions and very, very important questions. I like the one. So thank you. I don't get much for say, just for say everything you've been fine anyway. Very informative.
Thank you so much.
Thank you very much. My family, they can't pass on to Uncle Doc. We could go and final word, then I will tell them. Yes, Dr. Kamara?
Yes, thank you so much, TM. I want to recognize and appreciate all my family, my colleagues, I see them, and of course, my teacher, I should say Nai, if I'm not mistaken, you know. Don't say no one say anything, but I see Nai because that name they very unique. You know, me classmate them, me schoolmate them, me family members, me one bro, you know, they all, I say thank you to you. And of course, una will come out far and wide, come for can support we do ya. Let we, you know, if we not enjoy this thing and I need to we not benefit from them because now the 70th one this world don't do. We must be doing something good. We go make una they come to we all the time. So do ya. The topic they want I want for let we do, una send them in. We go research pan them and we go present to una for let una able for enjoy and get benefit and scatter the word. If anyway they will know for April for let we reach this message to people and na free tonkers and that with the info now make with the talk Creole. Because in England with the info easily all over the world, info you just say we talk English. But no, because we target with people in a salon, now make we talk Creole, we're not the lingua franca of salon. Therefore, you go reach the massive way in the most remote part of the country, even if you listen to radio. So we want for let we get you know, let we get either TV or radio time. Do ya? If there's any way where anybody go for we either direct way or signpost to give you guidance to that, by all means. But remember, this life we not get spare one. Now make it nice for make you look after them. Now if you get well, buddy, I guarantee you definitely better pass the person we call a safe gentleman. So scatter the word and come back for joining you next time. By God's grace, we are supposed for giving us something maybe better than what we don't get today. So thank you very much, and God bless we all.
Well, plenty. Thank you. Thank you very much, Dr. Kamara. For everybody we don't join today, I'm sure there will become, we'll get another time again where we go recognize the one that we don't join with for a very long time. Some of us we recognize but we will make sure say we look at something in future because we don't do it before during the 1 year anniversary. And I'm sure at some point again we'll recognize people again for telling plenty. Thank you for all the sacrifices that they make for joining, because no matter how nice they design all their presentation here, no matter how much book them people don't learn, no matter how much they want to present, if you not join, then there's no point for not forbidden deals out on this. So I want to say plenty thank you to Una. I wish you all the best for the rest of the weekend and a blessed week ahead, and hopefully we will see you all again and plenty more in a month's time. Well, buddy, better pass gently. Good night.
Thank you.